First of all, case study. A 25-year-old male medical student present to outpatient department with a history of high-grade fever for past 10 days. He initially experienced intermittent fever, but it has now become continuous. He also reported headache, generalized weakness, anorexia, and abdominal discomfort. Over the past few days, he has noticed constipation followed by episode of loose stool. He denies any recent travel but mentioned that several of his hostel mates had similar symptoms a few weeks ago. On examination, the patient appeared toxic and mildly dehydrated. His temperature is 39.5 degrees Celsius. Pulse rate is 80 beats per minute, which is relatively bradycardia, and blood pressure 100 by 70 mmHg. There is mild abdominal distension and few rose spots are visible on his trunk. There is hepatosplenomegaly. Now think what will be the provisional diagnosis. And the provisional diagnosis is enteric fever. Now the question arises, what is enteric fever? Enteric fever is a potentially fatal multi-system illness caused by Salmonella typhi or typhoid fever, or Salmonella paratyphi A, Salmonella paratyphi B, or Salmonella paratyphi C, which is known as paratyphoid fever. Now, when we talk about the typhoid or fever, then this lady come. Any guesses who is this lady? This is none other than Mary Millen. He is the chronic carrier of typhoid fever. Okay, now came to the classification and nomenclature. So, Salmonella is a gram-negative bacterium belong to the family of the Enterobacteriaceae. There are many classification based on many things. First of all, the clinical classification. In clinical classification, we can divide this in two groups. First of all, that is typhoidal salmonella, and next is non-typhoidal salmonella. In typhoidal salmonella, this is mainly caused by the Salmonella typhi or Salmonella paratyphi, and it is generally caused in human host. And when we talk about non-typhoidal salmonella, it is generally caused other than humans, mainly other animals including mammals, reptiles, birds, insect. They also infect human, causing foodborne gastroenteritis and septicemia. Now, there is another mode of classification, that is antigenic classification, Kaufman-White scheme. Here, the classification within the genus is based on the different somatic O antigen and flagellar H antigen, which can be detected by the agglutination test with the respective antisera. Now, there are two terms that is very relatable with this, that is serogroup and serotyping. Serogroup, which is based on the O antigen, we have very different type of O antigen, and on the basis of O antigen we divided. That is in initial case we divided in A, B, C, but later the number increased and the serogroup is redesigned as a number 1, 2, 3. Let's take an example. If we talk about serogroup 2, then antigen 2. If we talk about serogroup 4, then it contain special antigen 4, and if serogroup 9, then contain group specific O antigen 9. Now what is serotyping? Then serogroup is further differentiated into serotyping based on the type of flagellar antigen, that is H antigen. Currently there are more than 25,000 serotypes in salmonella. Now, what is nomenclature? When we talk about any organism, basically we follow binomial nomenclature, where the first name represents the genus and the next thing represents the species. But there is a little bit difference. When we talk about Salmonella typhi, the S definitely represents the genus, but the typhi is not the species; it is the serotype. Let's take an example. Taxonomically, the correct nomenclature of the Salmonella is very much complicated. Why I am saying this? Because Salmonella, the species is Enterica, the subspecies is Enterica, and the typhi that we use in the name is nothing but a serotype. So, however, for routine use, simplified format is followed where only the genus and serotype name is included. For example, Salmonella, the serotype, typhi. So, in short, S typhi that we generally use. Now, what is the antigenic structure? There are three antigen, that is OH, uh, three antigen, that is somatic antigen O, flagellar antigen H, and one special antigen, that is VI antigen. Now, already we talk about O antigen and H antigen. We will discuss about the VI antigen. What is VI antigen? So VI antigen is a surface polysaccharide involved in the capsular antigen covering the O antigen. Let's suppose I have O antigen, so O antigen can be easily detectable by the antisera O. But if vi antigen present, then vi antigen is masking the O antigen. So if there is antisera O present but it cannot agglutinate with antigen O, so vi antigen, the term vi, it is in earlier cases it was considered that the V for virulence, the V antigen is a very poor immunogenic, and antibody titer is very low. It is not helpful in the diagnosis of the cases because it masks the O antigen, and it is used in the formation of the vaccines. Now, there is a little difference between somatic antigen O and flagellar antigen. In part of the cell wall, like here it is lipopolysaccharide, but here it is flagellin. If I talk about Widal test, then O antigen and S typhi is used. In Widal test, H antigen, in S typhi, S paratyphi, A are used. It is less immunogenic, it is more immunogenic. O antigen appear early, disappearance early, and indicate recent infection. H antigen appears late, disappears late, and indicate convincent stages. Now, this is very important point. When O antigen react with O antibody, form a compact, granular, chalky clump, and when H antigen react with H antibody, it form large, loose, fluffy clump. The agglutination keep place slowly and agglutination keep place rapidly. Optimum temperature is around 25 degrees Celsius. Here it is 37 degrees Celsius. Okay, now let's come to the main thing, that is pathogenesis. Before going to the pathogenesis, the main cause of enteric fever is the by taking consumption of the contaminated water. In the case study, there was point that hostel mate are suffering from the same disease, so might be the cause of using contaminated water. Now, there is an infective dose. In for infective dose, it is wrongly written. It will be 10 to the power 3, and it will be 10 to the power 6. Very high load of bacilli is needed for initiate the infection. And what is the risk factor? There are two risk factors. Number one is stomach acidity. Those who take regularly omeprazole, pantoprazole, like PPI drugs, have very high chances of typhoid fever. And if his or her intestinal integrity is decreased, like if he or she is suffering from the short bowel syndrome, then the chances of typhoid fever is very high. Now, so the first let talk about, in intestine there is a special kind of cell, that is M cell. So when the Salmonella typhi come to the M cell, it mainly form a membrane ruffles. It is also mentioned here. The intestinal mucosa Salmonella can trigger the formation of membrane ruffles on the cell membrane on the M cell. And these ruffles reach to the enclosed adherent bacteria within the large vessels. So when it come and bind with the M cells, it will be get internalized and it will form a vesicle type. So let's suppose this is a bacteria and it will form a vacuole, and there it try to reach the submucosal layer. We know that in gut there is four layer, but it will try to reach the submucosal layer. In submucosal layer there will be macrophage. So macrophage, obviously macrophage will try to phagocytose them, but my macrophage can't kill them. Why? Because this bacteria, they did some changes in their LPS. So that's why the macrophage can't kill them. So after this bacteria, they come to the lymph node, mainly the mesenteric lymph node, and after lymph node they through the thoracic duct they come to the circulation. When they are coming to the circulation, this is known as the first bacteremia, and after circulation they spread to various organ, and then they again came to the blood. So this is known as the second bacteremia. Now let's chop down all the points. The process is uptake, and this process is known as bacteria mediated endocytes, BME, the first step that we talk about, which is mediated by the specialized type of 3 secretion of the system, followed entry of the bacteria remain inside the vacuole for the cytoplasm. And go to the next slide. Then entry of the macrophage, we already discussed. The salmonella containing vacuoles, already discussed, cross the epithelium layer and reach to the submucosa where they phagocytose by the macrophages. Now move to the second topic, that survival inside the macrophage, because I already told that they will not get killed. The Salmonella typhi induce certain alteration in on it the surface of lipid polysaccharide so that no longer susceptible to the lysosomal enzyme or macrophages. Now, what is primary bacteria? Now, Salmonella contain inside the macrophage spread via lymphatics to enter the bloodstream. Mainly, this is mesenteric lymphatics, and this is known as the first or primary bacteremia. Now, what is spread? Then the bacilli disseminated throughout through the reticular system like liver, spleen, lymph node, and bone marrow, and other organs such as gallbladder, kidney, lungs, and further multiplicated and multiplication takes place. And after that, we talk about the secondary bacteremia from seeded organism which lead to formation and onset of the clinical diseases. So this was the pathogenesis. Now let's talk about the clinical manifestation. There are very fancy clinical manifestation. So first is step ladder pattern. What is step ladder pattern? So in the cases we talk about step ladder pattern means there will be curve of, if we draw the temperature curve of the this patient, then we'll see this kind of pattern where we'll get one portion with increasing the temperature, and the temperature will be remain constant for some time, and again it will be changed. If we do not induce the therapy, then it will keep on increasing, but if we give the therapy, then it come down, and without therapy it did not cross the natural line, that is does not cross the normal line. So here is a graph, you can clearly see, observe this portion. So this portion is the step ladder fever. Now, other symptoms like headache, chill, cough, sweating, myalgia, arthalgia, and another very important, that is rashes or rose spot. Let's take a photograph for example. So in this photograph you can clearly see this, these are all the rose spot. These roses spot are faint salmon color, belching, and maculopapular rashes on the trunk and chest, seen in 30% of the patient at the end of the first week. Now next, go to the second clinical manifestation, early intestinal manifestations such as abdominal pain, nausea, vomiting, anorexia, and this there is also diarrhea which is known as pea soup diarrhea. And there is faggot sign. Now what is faggot sign? When fever and bradycardia is combined, then this sign is known as faggot sign. So in typhoid there may chance of seeing this faggot sign. So important sign include hepatosplenomegaly can also be observed. In our question there was hepatosplenomegaly, epistaxis, this is nose bleeding, and relatively bradycardia. So this is a faggot sign I talked about. The fever and relative bradycardia will be combined. And other complications like gastrointestinal bleeding, intestinal perforation can occur mostly in the third and fourth week of the illness. And it is also very important symptoms, neurologic manifestation occur rarely, which include meningitis, cerebellar ataxia, neuropsychiatric symptoms, and this is very important, that is muttering delirium or coma vigi. Such a paranoid psychosis or hysterosis or delirium are aggressive behavior. Now come to the treatment part. So basically, when you come to the treatment part, the first treatment is third generation cephalosporin, like example ceftriaxone, the drug of choice for this treatment, and which is taken in 1 to 2 gram per day IV for 10 to 14 days. Now, another drug that is azithromycin, a alternative drug for the empirical therapy. Advantage is given in the orally and 1 gram per day for 5 days. Next, go to the second, that is fluoroquinine in like ciprofloxacin. Because of increased drug resistance, this is very important, it should not be given empirically. It can be given only if found susceptible. It given as 500 mg twice a day, oral, for 5 days. Now, drug that was used in the past is chloramphenicol, amoxicillin in the treatment for the carrier, like ampicillin and amoxicillin for the 6 week. Vaccine, the two vaccine that is needed, that is VI antigen capsular polysaccharide by VCAPS, and typhoral oral life attenuate is salmonella typhi. So these two vaccine are used. So let's come to the question once more time. So in this question I highlighted this portion, that high grade of fever, we talked about like step ladder pattern, then headache and generalized weakness, anorexia and abdominal discomfort, and then the hostel mate and the rose point. So all these point are, and even the hepatosplenomegaly, so all this point is indicating it's a case of enteric fever. So thank you.